take another question here. It seems like we're all obsessed with getting tested, but most would be told to self-quarantine and treat symptoms, even if tested positive. So please be more specific about how to treat those symptoms. For example, how to treat coughs. Take cough suppressants, expectorants for fever. Okay to lower with aspirin or ibuprofen. Get plenty of rest, drink lots of water. At what symptoms should you call your doctor? A certain temperature, so many days of a high fever, trouble breathing. This is from Kathleen. You and I talked about this a little yesterday, that we are doing something that is tricky because the rest of us are not doctors, but in this instance, we're going to have to make some decisions about what qualifies for talking to my doctor, calling my doctor, telelinking in with my doctor.
Yeah, I know. Okay, so I mean, nothing is absolute, but some pearls, and she hit a lot of these points. I mean, she's doing all the right measures for taking care of oneself at home, and that is using those fever reducers, making sure that you stay hydrated. But a few, I would say the top 4 symptoms where you make the call, but you're going to get medical attention, and you're not as concerned about, staying home to not expose people, is trouble breathing, chest pain, high fever, which in the community, in the adult community, would be over, when 104 or higher is considered high enough to get medical attention, and intractable vomiting or diarrhea because you risk dehydration. Certainly, if you have milder symptoms but are at high risk because you're immunocompromised, those are the kinds of patients that we would certainly want to at least be evaluated, potentially face-to-face with someone. But again, a phone call ahead of time so they know to mask and isolate you when you come.
Arwen?
So, Kathleen, the first part of her question is about getting tested. What's happening now is we actually have a conflict about the medical community wanting people to stay home. Don't worry about getting tested. You got those kind of symptoms, and the recommendations are absolutely on target. But people who do epidemiology, they're trying to track diseases, they're trying to make policies. They need to know what the prevalence rate is in our communities. So I think we're kind of on a little bit of a collision course between those that say, what is our prevalence here so we can make appropriate policies, and the medical community that's actually taking care of patients that says, stay away from the emergency rooms. If you can get testing, fine, but that's not key. You need to stay away from other people right now. Yeah.
That's an excellent point. And I think that's the disconnect right now, is that ideally, since we know that patients can have mild or very few symptoms, if we had our druthers, we would literally test everybody with upper respiratory symptoms, but we can't do that. So we just got guidance late last night, and I'm still trying to make heads or tails of it because it's a combination of my hospital's recommendations and the Department of the DOH. And basically the philosophy is, and this is true in medicine in general, if you're going to do a test, what are you going to do with that positive result? So in an otherwise healthy person, clinically, not epidemiologically, clinically, will a positive test change anything significant? Will that person get antivirals or so? The answer for the most part for healthy people is no. You're going to go home and isolate. You're not going to be treated with antivirals, but we need to know because we don't want you infecting other people. But if you're at a higher risk, you might actually be given antivirals. If you are at risk to transmit to someone in your home. For example, if you live with someone who's immunocompromised, maybe it's important to get you tested, even though you yourself might not be at risk.
Unfortunately,
it got more complicated for me since last night.